People are on start, buddy. Okay, the meeting is being recorded, everyone. And I guess I should be able to see the slides since I can't, but I know that we want to thank our sponsors, and they have done a fabulous job of allowing us to conduct these lunch and learns for the last 5 weeks. And it's been our pleasure to do that. And I think we all are looking forward to today's speaker, which is Dr. Hill. I could argue that Dr. Hill needs no introduction, and that most of you are very familiar with him and his work in the Sarasota area, particularly in the past almost 30 years at Sarasota Memorial Hospital. And I thought what I would do is, rather than list every single thing he's done, kind of talk about the things that you may not know he's done. Some of you may know that he has written and contributed to numerous publications, abstracts, and he's written a book on ambulatory obstetrics. He has also served as a reviewer for numerous publications, abstracts, and other articles for journals. He was named by Black Enterprise magazine as one of the top Black physicians in the country. First of all, if you don't know who I am, I'm Marilyn Lapidus. I'm the board chair of Healthy Start. And I'm originally from New Jersey, so his involvement with Rutgers University holds a special place for me, even though I didn't attend Rutgers University. And he was recognized as an outstanding alumnus at the South Jersey campus. He was also inducted into the Rutgers Hall of Distinguished Alumni because of his superlative achievements in both his professional and civic life. And I think when we get to his civic life, that's where my involvement with Healthy Start and his involvement as past past chair of Healthy Start has made this a very exciting year for us, even though we're dealing with the COVID-19 situation. He has stepped up and continued to provide and be involved in care of high-risk obstetrical patients, education for both our communities and the teams at the hospitals, and involved in medical legal issues. He currently is a physician at CenterPlace Health here in Sarasota. And before he yells at me for talking too long, very happy to introduce this afternoon Dr. Hill, who will be speaking on marijuana, CBD, and vaping during pregnancy. Thank you, Dr. Hill.
Gee, thank you, Marilyn. I appreciate that very much. Marilyn and I go back a long ways when she was working with a company called Metrics, and we first started giving presentations in Berkeley, and I remember that so well, and certainly miss California. I want to thank you all for logging in again for our Lunch and Learn, this virtual webinar series. I want to certainly thank our sponsors. We could not have done it without you. I want to thank the planning committee, all of whom you have met. And we hope that next year, this conference will not have to be virtual, but we'll just have to wait and see. We started off with PJ Brooks talking about mental health issues and the addicted patient. We talked about the MORE initiative from FPQC. And then we talked about COVID-19 and pregnancy, my good friend, Dr. Pat Duff. And then we talked last week about the first 1,000 days with Chelsea and Kelly Romanoff. So today we're going to talk about a topic that is frequently asked about. And I hope to share with you the information that we know about marijuana, CBD, and vaping during pregnancy. We don't have all the answers, but I hope that we will be able to share with you some information. At least once a week, someone will call me and say, is it okay if I use my CBD oil on my tummy to get rid of stretch marks. And at the end of this discussion, I hope you will know what I will tell them. I have no commercial disclosures or conflicts of interest, and these are the objectives: to understand the prevalence, effects, and concerns of using these substances during pregnancy and lactation, to understand what to do when faced by a pregnant patient using medicinal marijuana and says it's okay. And then 3, to understand how to counsel a pregnant patient using these substances, whether you're a physician, a nurse, a midwife, or one of our staff at your local Healthy Start. So when you return to work after your lunch, you will see a 22-year-old prima gravida at 14 weeks, or she'll call you, and then her urine is positive for marijuana. What does that really mean? As she discusses with her, she says she is smoking marijuana for her nausea and vomiting because she's 14 weeks pregnant. And she adamantly says nothing else works. She says it's natural, it's legal, and just marijuana, and everybody else is doing it, so why can't I? So therefore, it is safe to use during pregnancy. She inquires, what are the harmful effects of using it anyway? You all just made this all up. How do you reply to her so that she will understand, and how are we really doing with that? I want to ask you all, how often have you heard some variants of that story? But I'm sure that you have. This is a study that was done by Holland, and I won't show you a lot of studies, but this is one that I thought was really very important. And these authors titled their paper, Obstetric Healthcare Providers, that's us, Counseling Responses to Pregnant Patient Disclosures of Prenatal Marijuana Use. How are we doing? The authors recorded patients encountered and evaluated obstetric provider response to someone saying that they were using marijuana. 20% reported marijuana use at the OB intake. And I will tell you that's approximately the number of patients who are using. There were 47 different healthcare providers in this clinic or system. Half of the time, the provider did not respond to the disclosure at all. They simply said, okay. And remember, the provider could be the medical assistant or the nurse who was doing that initial OB exam. So half of the time, the provider did not respond to the disclosure at all. When discussed, the response was non-specific and focused on the toxicology screens and social services. And these were several of the responses. You know how it alters your mind when you have it, how it makes you feel. So think about what it is doing to the baby that is not even formed quite yet. It gets the effects as well, and we don't want to do that to the baby. Another response, the issue with marijuana specifically is just that it is illegal. So at the time of delivery, they will do a urine drug screen because you have a history of using it. If it is positive at the time of delivery, they will often have you force you to talk to Child Protective Services because it is a risk factor. Now remember, this was a study. I forgot exactly where it was done, but it was not done in Florida. And certainly, as we'll talk about, this is not what happens here. So based on that information, and it's not different than many responses, what do you think about those responses and how we are doing? And I think you would agree with me that those responses are poor and we can do better. So what is the scope of the problem? Cannabis sativa is the plant. That's the plant, marijuana, cannabis. It's an illicit drug most commonly used during pregnancy, after tobacco and alcohol between the ages of 18 and 44. Now remember that cannabis is federally illegal. It may not be illegal in a particular state, but it is federally illegal. Now, the self-reported prevalence, that means if you ask patients, are you using marijuana, varies from place to place and state to state. Several studies showed that the self-reported prevalence, if we ask our patients in the clinic, are you taking and using marijuana, it ranges from 2 to 5%, and it seems to increase to 15 to 28% among young, urban, socially economic disadvantaged women. A growing number of states are legalizing marijuana for medicinal, and we are one of those, or recreational, we are not one of those. And currently, 29 states, and this was before a couple Tuesdays ago in Washington, D.C. But if we just focus on Florida, medicinal, yes. Recreational legalization, no. So the use by pregnant women could increase even more with the legalization of marijuana. So how common is marijuana use during pregnancy? And this is, I think, what we can gather from most of the studies and most recent evidence. Nationally, about 10 to 11% of pregnant women overall report using marijuana in the past year. Just think about that. About 10 to 11% of the pregnant women we see report, and remember that this is probably underreporting, so it is at least 11%, and 3 to 4% say that they've used it in the past month. And again, this is underreporting. Of pregnant women who used marijuana in the past year, 16.2% use it almost daily. And we can all think of patients who say, yes, I use marijuana daily. So it's an increasing problem. So what do we know about the effects of marijuana use on pregnancy? And I've shown you the picture there for those of you in the audience who have never seen marijuana. Does marijuana cross the placenta? Now remember, the active chemical compound in marijuana from the cannabis plant is THC. So THC is the main chemical compound in marijuana, produces that high, and crosses the placenta rapidly. There is no question that it crosses the placenta. There have been a number of studies, both in animals and in human studies, that show that. The next is that THC can be detected in mother's urine for weeks, depending on the potency of the drug, which is increasing, and the frequency of the use, and the metabolism, and other factors. So there's a number of variables. The important thing clinically here is that a patient can tell you, I haven't used any marijuana in the last 2 weeks, and their urine be positive. And you can see the reasons why that might occur. So don't assume that she's lying and accuse her of that, because it depends on the factors that I've listed there. And then the concentrations in the fetus. Does the fetus get THC or marijuana? And the answer is yes, because it crosses the placenta. And you can see from most studies that about a third of the levels found in the mother are the levels that are found in the fetus. So there are a number of study design challenges, and I've had patients tell me this in the office. Well, the studies don't make any sense, and they point out these reasons. that most pregnant women who use marijuana also use tobacco, alcohol, or other drugs that have harmful effects on the developing uh, fetus or child. So when we talk about the effects, we don't know whether the effects are from tobacco, alcohol, other drugs, or the 2% of patients who simply have an abnormal child in the first place. And it's difficult to measure these exposures and isolate the effects of marijuana, whether that marijuana be from mother or father. And there are several studies that show that the effects can also be from the father because the mother is getting secondhand smoke. So the mother may not smoke at all, but the father's a heavy smoker, and therefore the mother is getting secondhand marijuana smoke. Make sense? And then the other important subject, and this was reported just recently, is the rising marijuana potency worldwide. This is not your grandmother's marijuana. The effects and the strength of the marijuana is much stronger. So these are the study design challenges. This is all in the background of the effects. And these are the effects that you can see and that we can list for the effects of marijuana. First, the short-term effects or birth outcomes, fetal growth, small effect. There is some effect when it's smoked, and we'll show that in a minute. Anomalies. Does marijuana cause birth anomalies or withdrawal effects in the neonate, like neonatal abstinence syndrome? No effect. Neurobehavior. There are studies that show that neurobehavior, neurodevelopment, and perhaps stillbirth are increased and abnormal in terms of neurobehavior and neurodevelopment in those who smoke marijuana during pregnancy. And then if we look at the long-term effects in terms of growth, no effect, behavior and cognitive effects and lung development, certainly an effect, language, no effect, and there does seem to be an effect in some studies on achievement and spontaneous preterm birth. And the reference for this is the ACOG committee opinion of 2015. So we can say that for sure there are some effects of marijuana when used during pregnancy with the challenges of the studies that I mentioned. And this is an interim update of that report. It was October of 2017. Studies show marijuana plus smoking. So if someone is using marijuana and they're smoking it, you can see that there may or may not be an increase in spontaneous preterm birth, depending on the study, and there may not increase the risk of birth weight less than 2,500 grams. So there still is a question as to preterm birth, and there still is a question about a small progestational age or a low birth weight infant. Both of these would suggest not smoking marijuana during pregnancy. And then, as I mentioned, the ACOG committee opinion was modified also to indicate a higher stillbirth. But again, because of the studies, it's hard to interpret that. There's limited data. We need more well-controlled studies. But certainly in some studies, that there is an increased risk of stillbirth. So this is information that you can share with patients. Whether or not they will believe it or not is another issue. And what about the effects of marijuana use on lactation? I think we can say that THC, the active component, passes to the neonate in breast milk based on limited data. And the estimated exposure is about 1% of the maternal exposure, and the chronic heavy users would have a higher amount in the breast milk. This is a study done by Ashley and other colleagues who looked at breastfeeding and assessed neurodevelopment in babies who exposed via breast milk and through prenatal exposure. And they found that exposed infants scored poorly on psychomotor development index studies compared to the non-exposed. They looked at babies who had received marijuana either during their prenatal course or in the breast milk, and this is what they found. 84% of the women who used while pregnant also continued with breastfeeding. So keep that in mind, that if a mother used during her prenatal course, more likely than not, 84% continued while breastfeeding. So we can say, I think, from this study that exposed infants scored poorly on psychomotor development index compared to those who were not exposed. So the AAP, the American Academy of Pediatrics policy statement on breastfeeding and the use of human milk, breastfeeding is contraindicated in women using illicit drugs, including marijuana. What we have done at our institution, and I want to thank Mary O'Connor for helping get this together, and Ellen Capel for helping me also, so I can show it to you. These are 2 flyers that we have at Sarasota Memorial. You're welcome to copy them, steal them, use them in any way that you wish, that talk about marijuana and your baby. And we share this information with our patients in the clinic. And I know that Healthy Start has them as well. They're in English and they're in Spanish. So much about marijuana. The issue there is certainly trying to share that information with our patients, because some patients simply will not understand or agree with you that that is really a problem. So what about cannabidiol or CBD? Is it safe? We have patients who say it's got to be safe, it's natural. My friends use it for their stretch marks, for lotion. They take a tincture, a little bit of it for whatever. All I can tell you is that if you look in the literature carefully, number one, cannabidiol or CBD has been recommended for a whole host of things, and perhaps some of you are using it for those things. The next thing I can tell you is that that is based on little or no data at all. So what is cannabidiol or CBD? Is it pregnancy safe? Now, these next 2 points are important to understand, and I've tried to make them rather simple. Hemp and cannabis plants, hemp, remember hemp is, we used to use in the olden days, you young people don't remember hemp, we used to use it to make rope. So that hemp and cannabis plants are 2 different varieties of the cannabis sativa plant. Important fact, true fact. We didn't smoke hemp, but we did use it to make rope. Both contain CBD. So you can get CBD from hemp and you can get it from the cannabis plant. And the THC is the principal psychoactive constituent of cannabis. And I went around, I took my walk around the block yesterday. It was a beautiful day. And I found some hemp and I found some cannabis. And I took a picture. Just kidding. But as you can see, they look quite similar, correct? So what are the differences between hemp and cannabis? The main difference is the amount of each compound they contain. Hemp contains more CBD and minimal THC. Minimal. It doesn't say zero. So that hemp CBD can contain a small amount of THC. Cannabis contains more THC and less CBD, keeping in mind that THC is illegal. So that most CBD products are made from hemp for two reasons. One, they contain far more CBD and almost no THC, which is illegal. So that most CBD products that you see in the stores and gas stations and along the side of the road are made from hemp for those two reasons. The hemp contains far more CBD and almost no THC. So that all CBD products, regardless of where they came from, either hemp or cannabis, have to have less than 0.3% THC. So even those made from cannabis-derived CBD should contain less than this amount of THC. By law, they should contain less than 0.3% of THC. But again, you can have a hemp product, that hemp derived CBD that contains THC. Individuals considering pregnancy or pregnant using CBD in any form for physical or mental challenges should discontinue it and inform their provider. So if someone calls your Healthy Start or your office and says, I'm using CBD and I'm pregnant, is it okay for me to continue using my CBD for whatever indication they're using the CBD for? They should be informed to discontinue it and inform their provider and have a discussion with them. Now, the FDA has warned pregnant, and you've heard of the FDA certainly, has warned pregnant and breastfeeding women to avoid all CBD, all. Whether it's used orally, a little tincture, inhaled, or topical as a lotion for those wrinkles and stretch marks. THC and CBD in any form, including the food supplements and cosmetics containing CBD and other cannabis-derived ingredients, are not to be used during pregnancy. Which part of that is difficult to understand? So that no product using THC or CBD in any form should be used during pregnancy. And you may say, well, why not? We went over the effects, and those effects can cause problems with not only the unborn fetus, but subsequently with neurodevelopment. All right, what about medicinal marijuana? If it's medicinal, then it must be okay. Well, that's not true during pregnancy. THC cannot be medically condoned during pregnancy and lactation. So from a practical standpoint, as you're taking that OB intake and the patient says, yes, I'm using medical marijuana, I have a little card, I can use medical marijuana, I'm using it for XYZ, and it really works. What should you tell them? You should tell them that they should stop using medical marijuana during pregnancy, so that OBGYNs and midwives and Healthy Start staffers and all of you out there on this call are discouraged from prescribing or suggesting the use of marijuana for medicinal purposes during preconception, pregnancy, or lactation should be used. And as someone on this call said to me yesterday, sometimes you have to agree to disagree. You can share with them the information, but they may or may not hear you or follow your advice. And we certainly know that with other issues that are going on in our society today. So marijuana for medicinal purposes, pregnant women or women contemplating pregnancy should be encouraged to discontinue the use of marijuana for medicinal purposes. And remember, this marijuana comes in a variety of strengths, colors, potencies, etc. Now, this is important. Low THC cannabis. And in Florida, low THC cannabis, which is 0.8% or less, this is different than high THC cannabis, which is higher, can be issued by a certifying physician to pregnant women in Florida. I would tell you that ACOG would not agree with that. And in January, which seems so long ago, the Surgeon General and I were talking in Tampa, and he says, "You sure?" I said, "I'm very sure." So in Florida, the statute reads, and I think those of you who were with us last year, remember Ms. Campolio talking about low THC cannabis, and that it can be issued by a certifying physician to pregnant women in Florida. And of course, ACOG is against that, and our district ACOG is against it. And we actually had a statute for the Florida Health Association, FHA, this year, but that meeting was not held, and we were going to recommend that that be changed in the statute. Perhaps we'll do that next year, because low THC cannabis should not be taken by a pregnant woman, period. But remember that the low THC can be issued by a certifying physician to pregnant women in Florida. And we should be using alternative drugs. Many of these patients are using medical cannabis for other reasons. We should look for other therapies for that. We know that many of the women who are pregnant are using marijuana because of nausea and vomiting in pregnancy. We should try to help them manage their nausea and vomiting by other methods. And yes, nausea and vomiting in pregnancy is a terrible disorder for the pregnant woman. And yes, many of the drugs that we use don't work so well, but we really should not be using marijuana for nausea and vomiting in the first trimester of pregnancy for the reasons that I have already outlined. All right, so what does ACOG say about the use of marijuana during pregnancy? The American College of Obstetricians and Gynecologists recommends us to do the following. Ask all women before and in early pregnancy about their use of tobacco, alcohol, and other drugs, including marijuana and other medications used for non-medical reasons. And Lori Reeves and others of you on this call have talked to us about screening verbally and finding out what patients are using. So we should ask them. And we have to find a way to do that and to do it in a non-judgmental and thorough manner. We should inform all that they should not use marijuana during pregnancy or while lactating. I think that message is clear. We should counsel all reporting marijuana use about the concerns that I've pointed out regarding potential adverse health consequences of continued use during pregnancy on their fetus. And then we should use your Healthy Start and or behavioral health teams to help us get this accomplished. We should encourage all who are contemplating pregnancy or pregnant or breastfeeding to discontinue marijuana use. And I think you've heard that more than once during this discussion. And then clearly we need high quality studies regarding the effects of marijuana and other cannabis products on pregnancy and lactation. We need those studies, but until we have them, and it may be very difficult to get them, we may have to look at other countries, other states, other environments to get those results. And then most importantly, no medicinal marijuana during pregnancy. We need to understand that pregnant or lactating women or women contemplating pregnancy should not be prescribed and should be encouraged to discontinue the use of marijuana for medicinal purposes in favor of alternative therapies for which there are better pregnancy-specific safety data. And this is from the committee opinion of ACOG. And then we need to realize that yes, there is insufficient data, but this is the data that we have. And based on that data, marijuana use and CBD use is discouraged. So what do we tell patients who say to us, it's just marijuana, does not mean safe. It's just marijuana, or as I heard someone say, everyone's doing it, and this was a healthcare provider. She's using marijuana, but so is everybody else, so what's the problem? Well, this is the problem. It's important to share with patients that the use of marijuana during pregnancy is not safe. You cannot eat or use some foods and medicines while pregnant or breastfeeding. This is because they may harm the fetus. This includes marijuana. And I think this is very important for us to share with our patients. And then some say, since it is natural, it must be safe. And clearly, that is not the case. Not all natural substances or plants are safe. Tobacco and poisonous berries are great examples. They're natural, but they're not safe. And that marijuana contains THC, which may harm fetus. Well, let's move on. I hope I've convinced you and given you some information on what to share with patients in regards to marijuana and hemp and CBD. A doctor called me the other day and said, I have a patient who has been using marijuana and is vomiting, and she was in the emergency room. And is this the cannabinoid hyperemesis syndrome? And the answer is yes. From the chronic use of cannabis in pregnant or non-pregnant patients, these patients are frequently seen in the emergency room. They have protracted cyclical vomiting. They come in because they're vomiting. They may be on the cannabis because of nausea and vomiting in pregnancy, and they notice that it really doesn't help. And now I'm just having vomiting all the time. One of the first patients that we saw, we couldn't find her when the doctor went to the room, and the reason was she was always in the shower. and they have a compulsive hot bathing or showering behavior, and the reason's unclear. I'll show you on the next slide a possibility. And it does not usually respond to the usual antiemetic therapy. They continue to have this cyclical projectile vomiting. And you can see the first authors who reported this. The vomiting is severe, intractable. The patient is reluctant to discontinue the cannabis. The treatment is to discontinue the use of the THC. And I gave this presentation somewhere and someone said, so how's that working for you? And it wasn't, because the patients are very reluctant to discontinue the cannabis. Maybe the THC ingredient causing the syndrome. There's no effective and reliable treatment. If the patient refuses to stop the cannabis, some patients find that haloperidol may work. One of the questions is about the pathophysiology and the need for a hot shower. And what we can find, particularly in this article, is that there are GI receptors there are marijuana receptors in the GI tract. And when stimulated, when these receptors are stimulated, they can result in delayed gastric emptying, peristalsis, and vomiting. So the marijuana hits the GI receptors and causes those symptoms. And the psychoactive component of cannabis may cause the hypothermia, like it causes the munchies, and hot water bathing may be a reaction to that. So the doc who called me not long ago said, is this a syndrome that is occurring because of recent use of the cannabis? And the answer is yes, not from a month ago. Although that could be perhaps depending on the potency of the marijuana that they were using. So it's a syndrome that we need to think about, and you need to think about when you see your patients. Well, the last topic is one that's kind of new to us, and that is e-cigarettes. What you and your pregnant patients should know. We don't know a lot, but I tried to summarize here what we do know. This is a battery-powered unit. I'll show you in the next slide how it looks. The unit vaporizes a juice, and many things can be in that juice, including marijuana. It contains propylene glycol, glycerin, flavoring, nicotine, marijuana, and unknown ingredients. And the vapor may contain carcinogen substances, including heavy metals. I looked at one study that said the amount of heavy metals are less than in a cigarette. Well, that's cool. It's less than in a cigarette, but that doesn't really get me excited. And the cartridge equivalent is equal to 1 to 2 packs of cigarettes. So you can see that nothing on that slide looks good, does it? And this is the cigarette. None of you in the audience knows what an e-cigarette looks like, just like none of you would recognize marijuana. You can see the mouthpiece. You can see the cartridge, which contains the juice or whatever. You can see the atomizer, which heats the juice and makes a vapor. I was talking to one of my pulmonary docs and said, well, I guess it doesn't really help to heat the cells in your lungs. And she said, nope. You can see the microprocessor. And then many devices have a switch to activate the heating element. And then there's a battery. And I thought the bottom line was interesting. Some devices have a light emitting diode on the end to stimulate the glow of a burning cigarette. None of this makes any sense to me, and I hope it doesn't make sense to you either. So what are the important messages about e-cigarettes? All contain nicotine, which by itself has its own issues. It's not proven to be effective for smoking cessation despite advertisements, and you've seen them. Well, if you use an e-cigarette, you'll be able to stop smoking quicker. The content of the e-cigarette is not currently regulated by the FDA. It can be anything. And all contain stuff that you probably don't want in your lungs or in your fetus. So, how can I summarize this discussion? Neither marijuana or CBD or e-cigarettes should be used in any form during pregnancy. I think that's pretty clear, as our cat says. The references are here, and I'm ready to take any questions or answers. Thank you very much for your attention.
Thank you, Dr. Hill. We do have a couple questions in the chat. There is a question about alternative relief for nausea. What would you advise the mother to do?
Just submitted a chapter on GI diseases of pregnancy and researched all of that. And there are a number of products. We usually start with changing the diet, trying some ginger. There used to be a product called Bendectin that consisted of Unisom and vitamin B6, and that worked very well. Unisom we can still get now from the pharmacy, and vitamin B6 is a vitamin, so that works well. And then we have to work ourselves up the chain. And ACOG has a very nice algorithm. Sometimes we have to look at Zofran or Reglan. But these are issues that you need to discuss with your doctor or your midwife or your provider, and we can try and get you on something that works. But I would clearly say marijuana is not on that list.
Okay. We also provided for everyone in the chat, thank you to Mary O'Connor with Sarasota Memorial Hospital, the flyers that Dr. Hill referenced in his PowerPoints for the marijuana and your baby, both in English and Spanish. So if you're interested in that, you can download them there. There's one other question. It's from Grace Ann. She asks, marijuana can also cause PAWS, P-A-W-S, right? Is it recommended to taper?
I'm not familiar with PAWS. I'd have to look that up. It's not recommended to taper marijuana, if that's the question. I know of no reason and have not seen anything in the literature that would suggest, well, you can't just stop marijuana. No harmful effect from just stopping the marijuana.
Okay. PAWS is post-acute withdrawal syndrome.
Again, I know of no reason why you cannot stop marijuana abruptly, like now.
Okay.
Any other questions? You're welcome to unmute yourself and
Yeah, Dr. Hill, I have a question. It's very clear that the message that we want to give patients, it would be ideal if we could get that message out before they were pregnant. But how do you counsel a patient during their first prenatal visit if they, tell you they've been either smoking marijuana, eating it, doing any of these things, and is there anything you can say to reassuring to them, because now they're going to have it in their mind that they've put their child at risk, and how do you balance that?
That's a good question, and two good parts. I'll take the second one first, since I can remember that one easier. And that is that I would share with a patient that more likely than not, she really has not caused any harm to the fetus, and that she should just proceed with stopping it and carry on with the rest of her pregnancy. And that, and look, Marilyn, you've not done anything harmful. Let's get you to stop. There's no reason why you can't stop now. It's not going to hurt the baby. Let's do that. And then what we try to do is to get them over to Healthy Start or have Healthy Start talk to them. What was the other part? See, I told you.
Prenatal. That wouldn't it be ideal if we could get the message out to the community? Stop before you get pregnant.
This is one way. This is one way how we try to do it. Not only is it important when we see a patient who's using marijuana to encourage her in a non-judgmental and a loving way to stop it, but it's also important, as was mentioned over and over again, for those women who are thinking about pregnancy, who are saying, you know, I don't know, I don't. If it happens, you know, we see patients, if it happens, it happens. Well, those women should not be using any drugs during their pregnancy. So we should encourage the patient who is preconceptual, who is of reproductive age and could get pregnant, not to be using any drugs at all during pregnancy. In fact, what we encourage them to do is to be taking a prenatal vitamin.
Great, thank you. Sarah, do we have anything else that's popped up?
No, just a reminder also that Healthy Families, and we do refer to them through our Connect program as well. So we do have other home visitation programs in the community as well. So
Great.
I think that's it.
I have a couple final announcements and words to say. I just can't say thank you enough to everyone who's participated. And since this is the last one of our series and we were lucky to have Dr. Hill presenting it, I just want to make the over 60 people that are on the call aware of the fact that you're going to hear more in the next couple weeks about how our community is honoring Dr. Hill. Working with the Charles and Marjorie Bransick Foundation, Healthy Start Coalition of Sarasota County has been able to create in his honor an endowment fund that will be used to ensure that we're able to continue to offer our programs in the future. And this is a long-term project, but we are asking people now to contribute because there's a matching fund. The Bransick Foundation will match dollar for dollar every contribution. And all you have to do is go to healthystartsarasota.org, click on donate. You'll see Dr. Hill's picture there and make a meaningful donation to honor him. I also want to thank our sponsors for today, Drug-Free Charlotte County and District 12 ACOG. Sarah mentioned the survey, and we really would appreciate your feedback. I'd also like you to take some time to think of other topics that you might be interested in our having lunch and learns on. I think we're going to be doing lunch and learns type things for a long time still. So if you would send Sarah an email, you have her address, and it would give us some ideas that we could probably launch something early 2021. Again, the survey, thank you everybody. I can't think if there's anything else. So we just really appreciate everybody and stay safe, wear your mask, and we look forward to seeing you in the future.
Thank you all very much. I hope this series has been helpful, and thanks for all the presenters. Thank you very much.